How has the increase in dementia influenced designers' approach to healthcare design? The world population is aging, which has resulted in an increase in dementia cases since dementia was first discovered. 30 years ago, we had no idea what impact this would have on society, but it has given us years of viewing and developing design and principles fitted for people living with dementia, as well as understanding the importance of environmental impact. So, what have we learned from this? How has this influenced us when approaching a new project? Is this affecting the design for other environments and settings? These questions leads to a bigger debate, but first, let's investigate what is dementia. It is commonly said that dementia is an umbrella term with a collection of symptoms caused by disorders affecting the brain and impacting memory, thinking, behavior, and emotions. Most commonly is Alzheimer's disease, which affects between 60 to 80% of the cases. Getting diagnosed with a disease like dementia will change your life drastically, and from diagnosis to the end of life, the disease progresses, which means that the symptoms will gradually get worse. These symptoms can be laid in stages, and most commonly, there are three stages: the early mild stage, the mid-moderate stage, the late severe stage. Dementia is in fact one of our biggest challenges when it comes to our aging population, and by 2020 there was an estimated rate of 55 million people worldwide living with dementia. This number is set to double within 20 years and will reach 78 million in 2030 and 139 million in 2050. Most of the increase will be in developing countries. Moreover, there are 10 million new cases of dementia each year worldwide, which imply one new case every 3.2 seconds, and it is estimated that 1 in 3 people over the age of 65 will be affected by dementia during their lifetime. What these statistics show is that dementia is indeed starting to become a major public concern, which again requires a need for an environment fit for the needs of these individuals. And certain designers and architects have taken this matter seriously and have become so-called pioneers within the field. It all started in 1906 with Alois Alzheimer when he introduced his report, A Peculiar Severe Disease of the Cerebral Cortex. In this report, he described a 50-year-old woman he had followed for 5 years till her death. The reason for this study was that this woman showed signs of senility at such a young age, and during the time showed admissions for paranoia, progressive sleep, memory disturbance, aggression, and confusion. Later, he followed up with a number of cases with similar pathology. At this time, the medical interest in older people was low, since it was expected that an elderly person over the age of 65 would most certainly show signs of cognitive impairments. This was a common view and therefore not interesting enough to be studied. However, when it was discovered in a younger person, it became a cause for medical interest. The medical research continued for the following 65 years, but the attention to caring for these individuals daily was seldom explored, even until the year of 1975, when healthcare professionals hardly recognized dementia as a major concern. It was seldom patients presented with Alzheimer's, and there were hardly any educational practice around this. Some innovations came during the years, but these approaches to the measurements of dementia tells us how people with dementia were viewed at the time. Only a few practitioners and clinicians in the 1980s were aware of the future place the Alzheimer's disease would hold in the healthcare arena. And at the same time, there were a few architect, designer, and landscape architects that saw the importance of the field of designing for dementia. However, around this time, a change started to emerge, and a new field called environmental psychology was evolving. Here they made a point that the physical environment had a direct influence on people and the way they behave. This was not only directed to people living with dementia, but in 1987 a paper was presented with a description of environmental design principles when designing for dementia. These became a set of principles that would later guide the first large scale in Australia to provide home-like accommodations for people living with dementia. The people behind this were Richard Fleming and Kirsty Bennett, and along with other researchers such as Margaret Calkins, Gary Weissman, Ewan Cohen, Laurie Hyatt, Brian Kidd, and John Sisel, developed methodologies for studying the use of space by persons with dementia. This research later became the basis for a rich design-related literature that includes evidence-based descriptions of intentional paradigm-shifting environments, research findings, and both design principles and specific design approaches to guide the design of future environments for people living with dementia. Other groundbreaking findings in the field of research and design came with Jeanette Spiring, who in 1993 founded the Hogway, the first dementia village, which eventually opened in 2009. This was the first dementia village built, and the concept evolves around the concept of scale beyond family, extended family, community, to the village of scale. This way of designing nursing home facilities has been groundbreaking, since this is a way of enlarging the independence of belonging for people living with dementia, as well as creating a familiar/home-like setting so they do not feel estranged from the environment. This way of designing has in the last year emerged, and we can see newly built projects inspired by this, such as the Carpe Diem Dementia Village in Baden and the Dux Alzheimer Village in France. Another important groundbreaking invention was rediscovering how nature affects people's behaviors. Gardens can have a large impact on how we feel, and one pioneer that has enlightened this is Claire Cooper Marcus. She is one of the co-authors of the Therapeutic Landscapes and Evidence-Based Approach to Designing Healing Gardens and Restorative Outdoor Spaces. This was written with Naomi Sachs and brings out the importance of access to nature in the form of garden to maintain well-being. In the World Alzheimer's Report 2020, Design, Dignity, Dementia, Dementia-Related Design and the Built Environment, Richard Fleming, Kirsty Bennett, and John Sisel has looked into dementia-related design, the progress to date, best practice pioneers, and innovators such as the ones mentioned earlier. In the report, they mention strong statement that design for dementia is indeed 30 years behind the physical disability movement, and that this must change. They address themes such as the design principles for a new point of view and designs up to date in caring facilities, day centers, etc. But one important note is how they paint a picture of how people living with dementia and designing for them is a journey that must start and finish with dignity, as we move from knowing why we design and to how we design. Designing for dementia is a large topic, and we have guidelines and principles that need to be viewed and followed when approaching. So far, this video has addressed some of the challenges in the earlier years, from when dementia was first discovered and why we are still facing a challenge with environments that are not fitting the need of people living with dementia. We have learned from the previous year that this is something that needs to be addressed to raise their quality of life. As for design, the approaches that we use are still highly relevant, and while there is always room for improvement, we see that some of the innovations are working. Like Wilhelmina Hoffman said in an interview conducted with John Sisel, what works for people with cognitive problems will work for many, many, many more. In the field of healthcare design, we are working on environments that should fit the caring and healing process of people conducting it. As well, it is important to look at the needs of the healthcare professionals and the carers. This is all a large process since there are so many people involved, and we see that the knowledge base has widened, but there is still a lack of people with the right expertise to work on the issue. So how has the increase in dementia influenced designers' approach to healthcare design? With the increase of dementia, a larger acknowledgement has been set in place, and while it is continuing to grow, so is the interest in designing better environments for care, well-being, and quality of life. However, one issue that has occurred during this study is the lack of interviewees and learning about the influence dementia has had on design. Through reports and research, you can see that the new methodology within healthcare design is to promote the whole field and to create a larger scale of dignity and independence. Without these factors, the design will not meet the requirements and what is expected today. The design shall be inclusive, but since the topic is quite sensitive because of the newness in the field, I choose to go back to see through my own process within the 2 years I have learned, researched, and designed for dementia to see what this has taught me and answer the question meant for the interviews. During the past 6 years, I have had a first-hand experience with a close family member affected by Alzheimer's disease and have for 2 years worked as a person-centered assistant for this person. During this time, I viewed the challenges up close and started to research the field in 2019 for my bachelor's project. What this has shown me is that the challenges of people's perception of dementia are wrong, and acknowledgement for better healthcare environments along with offers needs to be addressed and taken into consideration, both for the person living with dementia and for the appointed carers. During my 5 years of studying interior, little has been talked about when it comes to designing for dementia or dementia-related design. Once or twice has there been a talk about designing for older people, but little has been addressed about people with cognitive impairment and mobility challenges. In my experience, the changes start already from the very beginning of the project, trying to understand why I designed this, research on the topic, and how I can design an environment that is easy to use for a person with dementia. Often I find myself in situations where I must sit back and view how this could affect my person and how it would affect me if I had the same impairments as my family member. So, in conclusion, the process has widened, and my thought process and research process are much more in detail than what I can remember. It is not just to design something nice, but something that is innovative, humbling, and is there to be helpful instead of stressing. The process has become on a much larger scale, person-centered and person-focused, and it is always the users on the design of the design that are valued.